Hello and welcome to Spire Cheshire Hospital. The aim of this educational video is to give you some guidance on what will happen when you come to stay with us for your joint replacement surgery. This will be a 1 or 2 night stay, though your discharge is dependent on you being medically fit and able to mobilise safely. In this video, we will cover practical tips on how to prepare for your surgery, what will happen during your hospital stay, and advice on how to manage once you are back home. Please use this video to supplement information given to you by your consultants and other health professionals. Please note this information is specific to Spire Cheshire Hospital and may differ across Spire sites.
Before you come in for your surgery, you will have an assessment over the phone and face-to-face with one of our pre-op nurses. This is a vital part of your preparation for surgery. We will assess things like your height, weight and blood pressure, as well as your medical history, any allergies and advice on medications you may already be taking. This is important as some of these need to be stopped prior to surgery, whereas others can be continued. Your nurse will go through this with you and you can use this opportunity to discuss any concerns that you may have. You will also be asked to complete a PROMS survey online. This stands for Patient Reported Outcome Measures. It takes approximately 10 minutes to complete and it is a national survey which informs the NHS and Spire Healthcare centrally about your quality of health and well-being both before and after surgery. You will be asked to complete the survey again at around 3, 6 and 12 months after your surgery. Please note, if you have any questions regarding your nurse's assessment, you can find the contact details in the description at the end of the video.
A joint replacement is a big operation and will cause pain and swelling in the first few weeks. You will therefore need support when you are discharged from the hospital. You may need help with washing, dressing, cleaning and shopping. It is essential for you to arrange a friend or relative to collect you from hospital and someone to stay with you following your surgery for up to 2 weeks or longer depending on your circumstances. You will be discharged wearing below-knee stockings which are designed to prevent blood clots. You will need family or friends to assist you when changing these. The nursing staff will advise you on how long you will need to wear them for. Stocking up on food and frozen meals prior to admission is a good idea to reduce meal preparation in the period immediately post-op. It is also best to remove anything that could potentially cause you to trip, such as rugs or trailing cables. This will allow you to move safely around your home whilst using walking aids. If you currently are able to mobilise up and down stairs, you should be able to do so after your operation. A solid handrail is advisable, and so if you haven't currently got one, getting one fitted before admission is recommended. You will practice on the stairs in the hospital prior to your discharge. If you care for anyone else in the household or have a pet to look after, you may need to arrange extra care for that person or animal while you are recovering from your surgery. You will be able to use a walk-in shower following your surgery. While you are on the ward, the nursing staff will assist you with showering. If you do not have a walk-in shower at home, we do not advise that you attempt to climb over the bath with elbow crutches and a wet floor. A strip wash at the sink is recommended until you are more mobile. Following your hip replacement, you need to ensure the height of your furniture is appropriate. This will reduce the risk of complications. Low seats, sofas and beds are not recommended following a hip replacement. To determine the correct height of your chair and bed, sit on a chair with the knee bent at 90 degrees. Measure from the crease at the back of your knee down to the floor. You then add 2 inches or 5 centimetres to this measurement, and this gives you the height of the chair and bed that you will need to use after surgery. To check the height of your chair and bed, measure from the top of the cushion or mattress, allowing for any give in the cushion or mattress to the floor. For example, a measurement of 17 inches from the crease of your knee to the floor would require your chair and bed to be 19 inches from the cushion to floor. If you are unsure about the measurement of your chair or bed, you can estimate the correct height. When you sit on the chair or bed, your hip should be higher than your knee. If your knee is level or higher than your hip, then the chair or bed is too low. If your chair is slightly too low, you could use foam pads or cushions, and if your bed is too low, you could use a sheet of foam or second mattress to make it the correct height. If your chair or bed is very low, you will need to source a different one. You may be able to borrow from friends or neighbours. We will provide a toilet seat raise for you while you are in hospital. You will be able to take it home with you on discharge. The raised toilet seat can be 2, 4 or 6 inches in height. To determine the correct height for you, you will need to take a measurement of your toilet at home. You do this by measuring from the top of the toilet bowl to the floor. The toilet seat then sits directly on top of the bowl. You will be provided with a long-handled shoehorn. This is to help you get shoes and slippers on. You will also be provided with a helping hand or easy reach. This can help you if you drop anything on the floor and also to help you dress or undress. If you require further equipment, you will need to source this independently. If you have any concerns about your home arrangement or support post-surgery, please let us know prior to your admission. You will need to bring in appropriate nightwear and a light dressing gown. You will be getting dressed into normal clothes the day after surgery. Please bring in loose, comfortable items such as shorts, baggy tracksuit bottoms or skirts. You will need to bring in shoes or trainers and slippers that have backs on them. Flip-flops and sandals may be unsafe. Slip-on shoes or trainers and slippers will be easier for you to manage. If you are buying new footwear, going up one size is better as your feet may swell after surgery. If you have any crutches used in a previous operation, you may bring these in with you. Your physiotherapist will check them to ensure that they are suitable to be used again. If they are not suitable, we will provide you with a new pair. You may also bring in a shoehorn and easy reach or helping hand. Please do not bring in any previously used toilet seat raises.
On the day of your surgery, you will come to the hospital and sign in at main reception. All patients will be collected by one of our ward clerks, then you will be taken to your allocated room. Once in your room, you will meet the different members of the team. On arrival to the ward, you will be admitted by a nurse who will go through your past medical history, so please bring in all your medication in the original boxes. You will have been allocated an approximate time of when you're due to go down to theatre. It's difficult to give you an exact time, but we will keep you updated. It is important to stay well hydrated before and after your surgery. Drinking plenty of still tap water prior to coming to hospital and leading up to your surgery will improve your recovery. It will also improve wound healing, help with any nausea and vomiting post-operatively, and will make it easier for you to pass urine after your surgery. Moreover, staying hydrated reduces the risk of blood clots. Once you have had your pre-op and been given your admission time, full fasting instructions will be explained to you. We also advise you not to chew gum or suck boiled sweets on the day of your surgery, as this will delay you going down to theatre. Your surgeon will come and see you prior to surgery too, to go over any final details and answer any questions. Your anaesthetist will also speak to you about the type of anaesthetic they will be using. A general anaesthetic can be administered, which means you will be asleep during the operation. This can make you feel unwell after the procedure. Almost all patients will have a spinal nerve block. This is an injection into the lower back which numbs the legs from the waist down. You may also be given sedation. This type of anaesthetic wears off around 4 to 6 hours following the procedure and will therefore help with early mobilisation and pain control. Blood clots can form in the deep veins of the leg, but it can also form in areas like the groin, abdomen and arm. These are known as deep vein thrombosis or DVT. Small parts of a blood clot can break off and travel into the bloodstream to the lungs. This is known as a pulmonary embolism, or PE, a very serious and life-threatening condition. Collectively, DVT and PE are known as venous thromboembolisms, VTE. Major surgery, particularly hip and knee replacement, increase the risk of VTE. 55% of all deaths from thrombosis are due to clots being formed when someone is in hospital. There are several things you can do to reduce the risk of blood clots following surgery. You can start circulation exercises as soon as your anaesthetic has worn off. Pull your feet up towards you and then point your toes to the floor, alternating both feet. Start deep breathing exercises as soon as able after your operation. Take 3 to 4 deep breaths every hour. Breathe in through your nose and out through your mouth. You will be actively encouraged to drink still tap water until 2 hours before your admission time. Staying hydrated, early mobilisation with healthcare professionals and compliance with wearing anti-DVT stockings and anticoagulation medication or blood thinners will also reduce the risk of blood clots.
After you've had surgery, you will be taken to another part of theatres called recovery, where you will be closely monitored. When you are ready, the nurses will collect you and take you back to your room. The nursing staff will provide regular pain relief and you will be given a call bell to call the nursing team when needed. Following a total hip replacement, there is a small risk of hip dislocation. To avoid this from happening, you will need to follow some precautions. Firstly, do not bend past 90 degrees. You will therefore need to avoid bringing your knee to your chest or leaning forwards, moving your chest to your thigh. This obviously makes it difficult to put shoes and slippers on, and this is why we provide you with a long-handled shoehorn and a helping hand. Secondly, do not cross your legs. And lastly, do not twist. This is mainly when you are standing, so when turning, you will need to ensure you step your feet round and do not swivel. These precautions will be in place for a minimum of 6 weeks, at which point you will be guided by your consultant and physiotherapist about how to progress. Early mobilisation following a joint replacement has been shown to reduce post-surgery complications such as DVT, PE, chest infection and pressure areas. It can also improve recovery and increase your confidence on discharge from hospital. You will therefore start mobilising with nursing staff once your anaesthetic has worn off and you are well enough to do so. This may be on the same day as your surgery. Early mobilisation can mean sitting on the edge of the bed, standing or walking. Do not get out of bed on your own. If you are unsure of what to do, there will be a poster in your room reminding you of your mobility status. Please do not hesitate to call the nursing staff if you have any concerns. The first time you mobilise with the nursing staff or physiotherapist, you will often use a Zimmer walking frame. In a routine procedure, you will be able to put as much weight through the operated leg as you can tolerate. We will progress your mobility as appropriate and will aim to move you onto elbow crutches as soon as possible. This can be on the first visit from your physiotherapist, and most patients will go home using crutches. Your physiotherapist will advise you if they are happy for you to mobilise independently or require supervision from a nurse or physio. We will encourage you to mobilise little and often throughout the day. If you require supervision, you will need to use the call bell by your bed. A physiotherapist will see you twice a day until you have met the discharge criteria. When using the frame, you will move the frame forward first, followed by the operated leg, and then your unoperated leg or good leg. To help you remember, you can use the acronym FOG: frame, operated leg, good leg. Ensure all 4 legs of the frame are in contact with the floor before you step. When reversing, step back with the good leg, then the operated leg, and then bring the frame backwards. This can be remembered as GOF: good leg, operated leg, and frame. If you are mobilising well on the walking frame, we will supply and measure you with a pair of elbow crutches. There are a number of different techniques when using elbow crutches. We will initially teach you the step 2 pattern, which mirrors the same technique you will have used with the walking frame. You will move 2 crutches forwards together. The operating leg steps level with the crutches, and then the unoperated leg steps level with the crutches. If the pain is being well managed and you have good muscle control, you may progress. The 2 crutches move forwards together. The operated leg steps level with the crutches, and then the unoperated leg steps through. This is the most advanced technique and the most similar to normal walking, although it may take some practice and may not be introduced until you return for follow-up physio as an outpatient. Once you are able to mobilise independently with elbow crutches, we will teach you how to climb a step or a set of stairs depending on your home environment. Place your crutch into the opposite hand to the side of the banister and hold it on the outside in a T shape and then hold on to the banister. You will put the good leg onto the first step, then place your operated leg onto the same step, bending your knee as able. Then bring the crutch onto the same step. You will continue this order for each step until you reach the top. At the top of the stairs, place the crutch back into your hand and move away from the top of the stairs. If there is no handrail, you would use 2 crutches, leading with the unoperated leg, then the operated leg, followed by the 2 crutches together. Coming down the stairs is the reverse of going up. Approach the top of the stairs with your toes slightly before the edge of the first step. Again, place your crutch into the opposite hand in a T shape, then hold on to the banister. Firstly, put your crutch into the middle of the step below and bring your opposite hand in line on the banister. Slowly lower the operated leg until the foot is down. Then bring your good leg down last so both legs and your crutches are on the same step. You will repeat this order until you are at the bottom of the stairs. If there is no handrail, you will place both crutches down first, followed by the operated leg and then the good leg. By using this technique, the unoperated leg does all the work, lifting you up as you climb the stairs and lowering you down as you descend the stairs. Please ensure you place your foot fully on the step and not on the edge. Your physiotherapist will start an exercise plan with you the day after your surgery using the following exercises. You will be provided with an orthoglide to help with these exercises. This is a disc that helps your heel to slide on the bed sheets. Please practice, familiarise yourself with these exercises before admission to hospital. This will help you to increase your range of motion at the knee and help you to walk following your operation. On the first day, you should aim to perform 10 repetitions of each exercise 3 to 4 times a day. You can then build to 30 repetitions 3 to 4 times a day. Lying or sitting on the bed, pull your foot up towards you and tighten your thigh muscle, pushing your knee firmly down into the bed as straight as you can. Aim to hold the muscle contraction for up to 5 seconds. Lying or sitting on the bed with a rolled up towel under your knee, pull your foot towards you and tighten your thigh muscles, straightening your knee as much as you can and lifting your heel off the bed. Hold for up to 5 seconds before lowering slowly. In lying, bend your knee and slide your heel towards your bottom. Keep your knee in a straight line. Do not bend your hip beyond 90 degrees. Keeping your knee straight and your kneecap pointing towards the ceiling, slide your leg out to the side. Then slide the leg back to the start position. Do not go beyond the midline. Please make sure you are not being collected in a car which has low seats. Before getting into the car, you may need a cushion to raise the height of the seat. The seat needs to be pushed right back and in a semi-reclined position. Putting a plastic bag on the seat may help you to slide into the car. Turn around so you have your back to the seat and remove your crutches from your forearms. You can then hold the door frame, seat or dashboard. Lower your bottom to the seat, sliding your operated leg forwards for comfort. Slide back into the seat and then rotate and lift your legs into the footwell. Remove the plastic bag from the seat so you don't slip forwards when the car stops or in the event of an emergency stop. Getting out of the car is the same as getting into the car but in reverse. Lift one leg out of the car, followed by the other, either using a H shape with your crutches and/or support from the door frame or seat. Stand up, making sure your operated leg is slightly in front of the other. You will be discharged from hospital when you are able to mobilise safely and are medically fit. Some patients can leave the day after surgery, although this needs to have been pre-planned between your consultant and the multidisciplinary team. Most patients can be discharged 2 days after surgery, and you will need to organise transport and other care requirements with this in mind. The criteria for discharge will be independently mobile and safe using 2 elbow crutches or other walking aids, independently mobile and safe going up and down the stairs if required, independently getting on and off a chair, bed and toilet. When you are ready for discharge, you may be asked to wait in the discharge lounge where you can be collected by family or friends. The nursing staff will be able to provide you with all the information you require to go home. You will receive an outpatient physiotherapy appointment. If this is at Spire Cheshire Hospital, it will be 1 to 2 weeks after your surgery. If you are an NHS patient, your follow-up physiotherapy may be through your local NHS provider, and they will contact you to arrange a follow-up appointment. The resident doctor will initially issue you with a sick note for around 2 weeks should you require one on discharge. Further sick notes can be provided by your GP or consultant. Further advice on returning to work should be provided by your consultant or physiotherapist. You will have a review with your consultant at around 6 weeks post-surgery. Your outpatient physiotherapist will guide you on progression of walking once you are discharged from hospital. You will go from using 2 crutches to 1 crutch to no crutches, depending on how well you are walking and how confident you feel. This is a gradual progression and will take several weeks. If you return to Spire Cheshire Hospital for your outpatient treatment, you will typically see a physiotherapist between 1 and 2 weeks following discharge. Your physiotherapist will assess you and decide on appropriate management. The provision of physio on the NHS may vary from that provided by Spire Cheshire Hospital. Your walking distance should be increased gradually over a period of time, and your level of function will be significantly improved by 6 to 8 weeks. However, remember, full recovery can take up to 12 months. If you enjoy going to the gym, your physiotherapist can advise you on when this is appropriate and what activities you can do. If you would like to go to the swimming pool, you will need to wait until your wound is fully healed to reduce the risk of infection. You will also need to consider how you will get from the changing room to the pool and back. Walking on the wet floor obviously increases your risk of falls. Your physiotherapist can advise you when the time is right to get into the pool.
Hello, I'm Steph, one of the pharmacists at Spire Cheshire Hospital. Our pharmacy team will be advising you on your medication from the pre-admission stage through to your discharge. While you are on the ward, you will receive a visit from one of the pharmacists who will go through your prescribed medications and how to take them. Before your procedure, you will be visited by the anaesthetist who will discuss medication used during your operation. At this point, please discuss with your anaesthetist any sensitivities and/or allergies that you may have to medication. You will be visited by a member of the pharmacy team. Firstly, to have a look at the medication you have brought in. We will count them in and record them on a drug chart. A pharmacist will then visit you to discuss the suitability of your medication, look for interactions and advise on anything new being prescribed. Please can I request that you bring any regular medication into the hospital in the original boxes, as dispensed by your local pharmacy, complete with labels. If you have been advised by our pre-admissions teams not to bring in any controlled drugs, then please leave them at home, as we will use ward stock during your stay. You will be given medication to control your pain in theatre and recovery. This will be continued on the ward. Initially, you will be prescribed strong pain medication, usually oxycodone, and then step down to weaker painkillers, for example codeine and oral morphine. Please be reassured that the medication prescribed can be adjusted during your stay. If you experience any side effects, intolerances or problems with these medicines, please let a member of the nursing team or pharmacist know, as together with the resident medical doctor we can find a suitable alternative for you. Your medication plan will be individualised according to your needs. You will be offered laxatives by the nursing staff, as constipation is one of the main side effects of the strong painkillers that we will be giving you. For your own comfort, please do take them. As part of your treatment plan, you will be prescribed a class of drugs called anticoagulants or blood thinners, as your mobility after your operation will be compromised. These drugs will reduce the risk of blood clots and DVTs. Please can I stress the importance of taking them as prescribed and completing the course as advised by the pharmacist. Together with your medication, you will be given a leaflet. Please do read this leaflet as it contains important information that will help you. When you're discharged, take-home medication will be prepared for you. You will be counselled on this medication by a pharmacist or a member of the clinical team. A copy of the medication we provide will be sent on a discharge summary to your GP surgery. Should you require further supplies of medication, please contact your GP surgery. Alternatively, please follow the advice on the sticker found on the medication bag. Please note that health insurance providers do not cover the cost of take-home medication. The pharmacist will advise you of the bill when handing out medication to you. Thank you very much for watching. Please feel confident in the fact that there is always a member of the pharmacy team on duty to advise on medication. And finally, on behalf of the pharmacy team, we hope your patient experience with us is a pleasant one and look forward to seeing you on the ward.
This will vary depending on how well you are walking. Some patients start weaning off their crutches after a few weeks, while others may take longer. In general, most patients will reduce their use of crutches by 6 weeks. It is essential that you develop a good reciprocal gait pattern. This means you are able to weight bear through the affected leg, achieve a straight knee on heel strike, and a good knee bend during toe off, i.e. heel-toe pattern. Weaning off crutches typically means that you move from 2 crutches to 1 crutch and then to no crutches, or perhaps a stick. Your physiotherapist will guide you through this process. The distance you can walk will depend on how well you feel and the management of your symptoms. We recommend that when you leave the hospital, you spend some time getting used to mobilising around the house first. When you feel comfortable, you can then progress to outdoor walking. Our advice is to start off with short distance initially and build up gradually over time. Having a joint replacement can cause a considerable amount of pain and swelling, particularly during the first 3 to 4 weeks after surgery. Taking regular analgesia will help you to stay on top of your symptoms and make walking and exercise a little easier. It is therefore important to follow the advice given to you by your nursing staff and the pharmacist. We recommend that you sleep on your back for the first 6 weeks following surgery. This may not be your natural sleeping position, however, lying on your side will increase the chance that your legs will cross over. You are usually able to start driving from 6 weeks after your operation. You must be free from using medications that cause drowsiness or impair cognition and decision making. You also need to be able to apply pressure to and control the accelerator and brake pedals with your right leg, and also use the clutch with your left. If you drive an automatic car, then you are only reliant on your right leg. If your operation is on your left leg, please seek advice from your consultant if you wish to drive before 6 weeks. Before you start driving, we would advise you to contact your insurance provider and ask them of any requirements prior to getting back to driving. Insurance policies are different and therefore there may be different stipulations. Once you are clear to drive, there is a legal minimum requirement to be able to perform a safe emergency stop. Once you can do this, the decision to when you start driving is yours. Just be aware long distance driving will have an effect on your joint stiffness and subsequent pain. If you are in employment, returning to work can vary depending on the type of job. If you are able to work from home, you may feel happy to do so in the early recovery period. However, you should consider that sitting at a computer for long periods can make your legs stiff and swollen. It will obviously take longer to return to more physically demanding jobs. Your physiotherapy sessions can replicate the demands and activities so that you can build confidence as well as the ability to do such things. We would always recommend a phased return to work, as this will allow you and your employer an appreciation of where you are up to and what assistance you might need. There is an increased risk of a VTE with post-operative travel. Increasing travel time is associated with increased VTE risk. For travel times greater than 4 hours and surgery that results in relative immobility, please discuss any plans with your consultant. There is an increased risk of a VTE up to 3 months post-surgery with travel duration longer than 4 hours. You can discuss any travel plans with your consultant, and if you do travel, appropriate VTE reduction measures should be taken, and you should inform your travel insurance provider and carrier. Thank you for taking the time to watch this video. We hope you have found it useful for your upcoming joint replacement. We look forward to welcoming you to Spire Cheshire Hospital. Of course, you might be nervous about the procedure, and this is completely normal. Please be assured that you will have the full attention of staff when you are here. If you have any questions, you will have the opportunity to ask us while you are with us. But if you need to ask anything more urgently, our contact details are at the end of this video. Many thanks, and we will see you soon.